Hello, today I will talk about acute appendicitis. This common cause of abdominal pain in all ages is particularly difficult to diagnose, especially in the extreme of age and in pregnancy. However, the diagnosis of acute appendicitis is often missed initially at all ages. The classic presentation is central colicky abdominal pain, followed by vomiting, then shift of the pain to the right iliac fossa. Many presentations are atypical, with a variety of other symptoms, like altered bowel habit and urinary frequency. This symptoms partly depending on the position of the tip of the inflamed appendix, which is rectocecal 74%, pelvic 21%, paracecal 2%. On examination, there may be no marked abnormality in the early stages, but the patient may be morbid with septic shock and generalized peritonitis in the late stages. Between these extremes, there may be a variety of findings, including fever, tachycardia, distress, fetor. There is usually a degree of tenderness in the right iliac fossa, plus or minus peritonitis. Rothstein's sign may be present, which is pain felt in the right iliac fossa, on pressing over the left iliac fossa. PR examination may reveal tenderness high up on the right, with inflammation of pelvic appendix. The diagnosis of acute appendicitis is essentially clinical. Scoring systems such as Alvarado score have been developed, but cannot be relied upon. X-rays are not helpful, but we perform urine analysis. White blood cells and CRP may be elevated, but this is not invariable. CT and ultrasound may help the surgeon to make the diagnosis in certain circumstances. Despite studies describing non-operative treatment of acute appendicitis with antibiotics, surgical intervention remains standard treatment. Obtain IV access and resuscitate as necessary. Commence IV fluids such as 1,000 milliliters of 0.9% saline if there is evidence of dehydration. Give IV opioid and antiemetic such as slow IV metoclopramide 10 mg. If acute appendicitis is likely, or ever impossible, keep nil by mouth and refer to the surgeon. If appendicectomy is required, preoperative antibiotics such as amoxicillin plus gentamicin plus metronidazole can decrease infective complications. If a diagnosis of acute appendicitis seems very unlikely and the patient going to be discharged, ensure that the patient is advised to return for review if symptoms worsen. Untreated acute appendicitis may proceed to perforation, with generalized peritonitis, or may become walled off to produce a localized right iliac fossa inflammatory mass. There are many other causes of such a mass, including cecal carcinoma, Crohn's disease, ovarian mass, pelvic kidney, ileocecal tuberculosis, zoosabscess, actinomycosis, and spigelian hernia. Thank you for watching. Goodbye.